How was your blood pressure medicine discovered? Imagine a time when high blood pressure was misunderstood and often ignored. For many years, doctors thought it was just a natural response of the body, not a real health problem. Treatments back then were primitive, like bloodletting or very strict salt diets, which didn't really help much. Some early chemicals used to lower blood pressure, like sodium thiocyanate, had serious side effects and were not safe for long-term use. It was a confusing time for managing what we now know as hypertension. The breakthrough started after World War II, when scientists began exploring new ways to treat high blood pressure. One of the first effective medications was reserpine, which came from a plant called Rauwolfia serpentina. Reserpine worked by depleting certain chemicals in the nervous system that cause blood vessels to tighten. It was used in the late 1940s and early 1950s and showed that lowering blood pressure could actually reduce the risk of strokes and heart problems. Soon after, other drugs like hydralazine and hexamethonium were introduced, giving doctors more options. But the real game changer was the development of thiazide diuretics in the 1950s. These drugs, like chlorothiazide, helped the body get rid of excess salt and water, which lowered blood volume and pressure. Thiazides were well tolerated and proved to be very effective in helping people live longer and healthier lives. In the 1960s, scientists developed beta blockers, which slowed down the heart and reduced its workload. This was a major step forward. Not long after, calcium channel blockers came into use, relaxing the muscles in blood vessel walls and making it easier for blood to flow. Then came the discovery of the renin-angiotensin system, a hormonal system that controls blood pressure. This led to the creation of drugs like ACE inhibitors, which block specific pathways that cause blood vessels to tighten, and ARBs, which prevent the hormones from acting. All these advances were backed by large clinical trials starting in the 1960s. These studies showed that controlling high blood pressure with medication can significantly lower the risk of strokes, heart attacks, and other serious health problems. Today, blood pressure medicines are a key part of preventing strokes and managing cardiovascular risk. They are the result of decades of research, from ancient remedies to modern science that targets the body's specific mechanisms for regulating blood pressure. If you are taking blood pressure medication, remember it's always best to work with your healthcare provider to find the right treatment for your individual needs.